Here's something you were probably never warned about. You can be doing everything you were told to do for diabetes, taking your medication, watching your carbs, trying to be disciplined, and still be losing the battle quietly day after day without realizing it. Not because you're careless, not because you're failing, but because the real problem may not be blood sugar at all. What most people don't realize is that diabetes doesn't just raise glucose. It drains your body of critical nutrients at the same time, creating invisible deficiencies that medication alone cannot fix. And the dangerous part is this: you don't feel those deficiencies happening. There's no pain, no clear warning sign, just slow, silent damage accumulating in your nerves, your blood vessels, your kidneys, while your lab numbers look acceptable. This is why so many people feel confused and frustrated. You follow the rules, yet your A1C refuses to move. You cut food, increase effort, add another pill, and somehow the problem keeps progressing. That contradiction isn't random, it's a clue. Because when key vitamins are missing, insulin stops working the way it should. Cells stop listening. Organs start aging faster than they should. And the enemy isn't something you can see on a glucose meter. Once you understand what's really being depleted, everything you thought you knew about managing diabetes begins to shift. When you look at diabetes only through the lens of blood sugar, you miss one of the most destructive processes happening underneath. Because while glucose stays high, something else is quietly being drained from your body, something your arteries, your kidneys, and even your insulin system depend on to survive. That missing piece is vitamin K2. And for many people with diabetes, the deficiency starts long before the first serious symptom ever appears. Vitamin K2 doesn't behave like a typical vitamin. It doesn't just support health in a vague way. It acts more like a traffic controller inside your body, deciding where calcium is allowed to go and where it absolutely should not be. When K2 levels are adequate, calcium is guided into bones and teeth where it strengthens structure. But when K2 is low, calcium loses its guidance system. It drifts into soft tissues, arterial walls, heart valves, and even the kidneys where it slowly hardens structures that were meant to stay flexible. Here's the part that rarely gets discussed. High blood sugar actively accelerates the depletion of vitamin K2. At the same time, diabetes increases the body's demand for K2 because glucose-driven inflammation and oxidative stress create more calcium misplacement. That means you're losing K2 faster while needing more of it, a perfect setup for silent damage. At first, nothing feels wrong. There's no pain signal when arteries begin to calcify. No alarm when microscopic calcium crystals start forming in kidney tissue. This is why the process is so dangerous. By the time symptoms show up, the damage has already been building for years. People often notice easy bruising, bleeding gums, or joint stiffness and assume it's just aging or part of diabetes. But underneath those signs is a deeper structural breakdown. Research shows that individuals with the lowest vitamin K2 levels have up to a 50% higher risk of developing type 2 diabetes in the first place. And in people who already have diabetes, K2 deficiency strongly correlates with faster progression of cardiovascular disease, kidney impairment, and nerve damage. This isn't coincidence. Vitamin K2 activates proteins like osteocalcin and matrix Gallet protein, which directly influence insulin signaling, vascular elasticity, and calcium balance. When osteocalcin is activated, something remarkable happens. Insulin secretion improves and cells become more responsive to insulin signal. Studies show that improving vitamin K2 status can increase insulin sensitivity by roughly 20 to 28%. That alone can mean the difference between glucose hovering just above target and glucose finally stabilizing. Over a period of several months, A1C reductions in the range of 0.35 to nearly 0.5% have been observed, not from cutting more food, but from restoring a missing biological function. Fasting blood sugar also begins to shift. Average reductions of 8 to 14 milligrams per deciliter have been documented, along with significantly lower post-meal spikes. That matters because those spikes are what quietly damage blood vessels and nerves, even when daily averages don't look alarming. At the same time, vitamin K2 reduces chronic inflammation by roughly 30%, which further improves insulin sensitivity and vascular health. The cardiovascular impact is where K2 truly stands apart. Arterial calcification, one of the biggest hidden killers in diabetes, slows dramatically when K2 levels are corrected. Some studies show more than a 50% reduction in calcification progression. Blood vessels regain flexibility, Endothelial function improves. Blood pressure often drops modestly but meaningfully, simply because arteries can finally respond instead of resisting every heartbeat. Kidneys benefit as well. Calcium buildup inside renal tissue contributes to declining filtration over time. Vitamin K2 helps reduce this calcification and has been associated with lower protein leakage in urine, a key early marker of diabetic kidney damage. Nerve tissue, often overlooked in K2 discussions, is also protected through K2-dependent proteins that shield neurons from glucose-induced injury. Improvements in numbness and tingling have been reported when deficiencies are corrected consistently. So where does vitamin K2 actually come from? This is where most diets fall short. K2 is found primarily in fermented foods and certain animal products. Natto, a fermented soybean dish, contains extremely high levels, though its taste limits widespread use. Hard cheeses like Gouda and Brie provide moderate amounts. Egg yolks from pasture-raised chickens and organ meats like liver contribute smaller but meaningful doses. Still, even with these foods, many people with diabetes fail to reach therapeutic levels because their metabolic demand is simply higher. That's why supplementation often becomes necessary. Vitamin K2 exists mainly in two forms, MK4 and MK7. MK7 stays active in the bloodstream much longer, making it more efficient at lower doses. MK4 acts faster, but requires higher amounts and more frequent intake. Typical therapeutic ranges used in research fall around 90 to 180 micrograms daily for MK7, taken with a meal that contains fat to improve absorption. Safety is one of vitamin K2's strongest advantages. There is no established toxicity level in healthy individuals, and doses well above typical intake have shown no adverse effects. The key exception involves anticoagulant medications, where vitamin K intake must remain consistent and medically supervised. Outside of that context, K2 does not cause blood clots, a misconception that prevents many people from addressing a serious deficiency. The real danger isn't taking vitamin K2. It's ignoring the slow calcification process happening while glucose stays elevated and inflammation remains unchecked. Because once calcium hardens arteries, valves, and kidney tissue, no medication can easily reverse it. And this is where the story deepens. Because calcium misplacement is only one layer of the damage diabetes creates. Once glucose overload continues long enough, it begins attacking something even more fragile than blood vessels, your nerves. And that brings us to the next critical missing piece most people never test for, but feel the consequences of every single day. Once calcium misplacement starts hardening vessels and kidneys, the next system to suffer is even more sensitive, your nerves. And unlike arteries, nerves don't just stiffen quietly. They burn, tingle, go numb, and slowly lose their ability to communicate. This is where the damage suddenly becomes personal. And it's also where one of the most overlooked deficiencies in diabetes does its worst work. That missing factor is benfotiamine, a specialized form of vitamin B1 that most people have never been tested for, yet feel the consequences of every day. Benfotiamine isn't just another B vitamin. It's a fat-soluble version of thiamine designed to cross cell membranes easily and reach tissues regular thiamine can't. That difference matters because in diabetes, glucose doesn't simply float in the blood, it floods cells and overwhelms their metabolic machinery. When that happens, glucose is forced down toxic pathways that create advanced glycation, end products, oxidative stress, and inflammatory byproducts that slowly poison nerves, kidneys, blood vessels, and the heart. Here's the hidden problem. People with diabetes burn through thiamine up to 70–75% faster than those without it. High blood sugar increases urinary loss, impairs absorption, and blocks thiamine's activation inside cells. So even when intake looks normal, functional deficiency develops quietly. Regular thiamine can't compensate because it's water-soluble and struggles to enter stress cells. Benfotiamine can. When benfotiamine levels are low, glucose toxicity accelerates. Nerve fibers lose their protective coating. Blood vessels feeding nerves narrow and stiffen. Mitochondria inside nerve cells begin to fail. At first, symptoms feel vague, unexplained fatigue, brain fog, loss of appetite, subtle memory slips. Then the signals become harder to ignore. Burning feet at night, pins and needles sensations in toes and fingers, sudden sharp pains that appear without warning, heavy legs, weak grip strength, poor balance. Many people assume this is just diabetic neuropathy and that nothing can be done. But that assumption is outdated. Benfotiamine directly blocks the four major metabolic pathways that turn excess glucose into cellular poison. Clinical studies show reductions in advanced glycation end products by 40 to 50% when benfotiamine is introduced. Inflammation markers drop by roughly 35%. Cells regain their ability to process glucose instead of being damaged by it, and that shift changes everything. Blood sugar control improves not because you ate less, but because your cells finally stop drowning in glucose stress. A1C reductions of 0.3 to 0.5% have been documented within 12 weeks. Fasting glucose often drops by 12 to 18 milligrams per deciliter. Post-meal spikes, the ones that silently destroy nerves and vessels, decrease by 20 to 35 points. That means fewer crashes, fewer highs, and more stability across the day. But the most dramatic benefits show up where damage once felt irreversible. Nerve damage progression slows by as much as 50 to 60%. Nerve signal transmission improves. Burning pain decreases sometimes within weeks. Many people report a 40 to 55% reduction in neuropathy symptoms within 3 months, not from numbing drugs, but from restoring cellular protection. Numbness retreats. Sensation partially returns. Sleep improves because pain no longer dominates the night. The protection extends beyond nerves. Benfotiamine supports the heart by reducing glucose-induced damage to cardiac muscle and electrical pathways, lowering the risk of diabetic cardiomyopathy. Blood vessels become more responsive as endothelial function improves and arterial stiffness decreases. Kidneys, which are constantly exposed to glucose filtration, benefit from reduced oxidative stress and lower protein leakage in urine, an early marker of kidney decline. Even the eyes gain protection as retinal blood vessels become less vulnerable to glucose toxicity. Unlike vitamin K2, benfotiamine isn't found naturally in meaningful amounts in food. Foods rich in regular thiamine, such as sunflower seeds. Legumes, pork, and whole grains support baseline nutrition, but cannot deliver therapeutic levels for diabetes complications. That's why benfotiamine is used clinically as a targeted intervention rather than a dietary tweak. Effective dosing typically falls between 300 and 600 milligrams per day, often split into 2 doses with meals. Clinical trials demonstrating nerve and glucose benefits commonly use 300 milligrams twice daily for at least 3 months. Absorption is reliable and consistency matters more than timing. Unlike many supplements, benfotiamine has an exceptional safety profile. Even doses up to 900 milligrams have shown minimal adverse effects. Occasional mild stomach discomfort or skin reactions occur in a small percentage of users, usually resolving quickly when taken with food. The greater risk isn't supplementation, it's allowing glucose toxicity to keep attacking nerve tissue unchecked. Because once nerve fibers degenerate beyond a certain point, recovery becomes far more difficult. Early intervention matters. And here's where the pattern becomes impossible to ignore. Vitamin K2 protects structure, benfotiamine protects cellular metabolism and nerves. But there's still one master regulator that influences insulin production itself, immune resilience, mood, and long-term glucose stability. And when that final piece is missing, even the best strategy remains incomplete. That brings us to the nutrient that quietly controls how well your pancreas, your immune system, and your cells respond to everything you've done so far, and it may be the most efficient of all. After protecting structure with vitamin K2 and calming glucose toxicity with benfotiamine, there's still one system quietly deciding whether your progress holds or slips backward again. Because even if your cells are protected and your nerves are calmer, blood sugar control can still fail at the source. That source is insulin production itself. And the factor that influences it more than most people realize is vitamin D3, also known as cholecalciferol. Vitamin D3 isn't just a bone vitamin. In reality, it behaves more like a hormone. Nearly every cell involved in glucose control, from pancreatic beta cells to muscle tissue immune cells and even brain cells, carries vitamin D receptors. When those receptors are understimulated, insulin signaling weakens, inflammation rises, and blood sugar becomes harder to control no matter how disciplined you are. Here's the problem most people never connect. Vitamin D deficiency is extremely common in people with diabetes, especially in adults over 45. Less sun exposure impaired activation in the kidneys, chronic inflammation, and higher body fat all lower circulating D3 levels. And as vitamin D drops, insulin production drops, with it silently, gradually, and often without obvious symptoms at first. The early signs are easy to dismiss. Persistent fatigue that doesn't improve with rest, muscle weakness that makes simple movement feel heavier than it should, aching bones, especially in the lower back or legs, more frequent infections, subtle mood changes, irritability, low motivation, or mild depression. Many people attribute these to aging stress or diabetes itself without realizing they point to a regulatory failure at the hormonal level. Inside the pancreas, vitamin D3 plays a direct role in insulin synthesis and secretion. When levels are optimized, beta cells respond more efficiently to rising glucose, releasing insulin smoothly instead of struggling to keep up. Studies show that correcting vitamin D deficiency can increase insulin secretion by up to 50 to 60% in individuals whose pancreatic function has begun to decline. At the same time, vitamin D improves insulin sensitivity at the cellular level, reducing resistance by roughly 25 to 35%. The impact on measurable numbers is significant. Clinical trials consistently show A1C reductions between 0.4 and 0.6% over 3 months in deficient individuals who correct their vitamin D status. Fasting blood glucose often drops by 15 to 20 milligrams per deciliter. Post-meal spikes, the most damaging swings, fall by 25 to 30 points. These changes don't happen because you restricted food further, but because insulin finally works the way it was designed to. Vitamin D's influence extends far beyond glucose. Cardiovascular risk decreases as inflammation inside blood vessels declines. Arterial stiffness improves. Blood pressure often drops modestly but consistently, with average reductions of around 6 points systolic and 3 points diastolic. For people with diabetes whose cardiovascular risk is already elevated, this shift can be meaningful over time. Nerve tissue also benefits. Vitamin D helps protect neurons from glucose-induced injury and supports repair mechanisms that slow neuropathy progression. Studies suggest nerve damage progression can be reduced by up to 40% when vitamin D levels are maintained in the optimal range. Tingling and numbness may not vanish overnight, but stabilization, stopping the downhill slide, is often the first critical win. Kidneys, already under constant metabolic stress in diabetes, rely on vitamin D for immune regulation and structural protection. Adequate D3 levels are associated with slower progression of diabetic kidney disease and reduced protein leakage in urine, an early marker of declining filtration. This matters because kidney damage rarely announces itself early. It advances quietly until function is significantly impaired. Immune balance is another overlooked benefit. Vitamin D strengthens innate immunity while calming excessive inflammatory responses. In people with diabetes, maintaining adequate levels has been associated with reductions in infection rates by more than 40%. Wounds heal faster, recovery from illness improves, the body stops reacting as if it's constantly under attack. So where does vitamin D3 come from? Sunlight remains the most natural source. About 15 minutes of midday sun can generate roughly 1,000 international units in fair-skinned individuals, though production varies by latitude, season, age, and skin tone. Dietary sources include fatty fish, like salmon, sardines, and mackerel egg yolks, and fortified dairy products. Still, food alone rarely provides sufficient amounts for people with diabetes. That's why supplementation is often necessary. Typical daily doses range from 2,000 to 4,000 international units for adults with diabetes, though some individuals require more under medical supervision. Blood testing is critical here. The goal is not guessing, but achieving blood levels between approximately 40 and 60 nanograms per milliliter. Below that range, insulin function and immune balance suffer. Above it, risk increases. Vitamin D is safe when used appropriately, but it is not casual. Chronic intake above 10,000 international units daily can lead to excessive calcium absorption, increasing the risk of kidney stones, irregular heartbeat, and vascular calcification, especially without adequate vitamin K2. This is why context matters. Vitamin D works best when part of a coordinated strategy, not as a standalone fix. Taken with a meal containing healthy fat, vitamin D3 absorbs far more effectively. Consistency matters more than timing. and interactions with certain medications such as steroids or weight loss drugs should be discussed with a healthcare provider. At this point, a pattern should be clear. Vitamin K2 protects structure. Benfotiamine protects cells and nerves from glucose toxicity. Vitamin D3 restores hormonal control and insulin function. Remove one and the system weakens. Restore all three and blood sugar control stops feeling like a constant uphill fight. But there's one final truth most people never hear. Supplements don't fail because they don't work. They fail because people don't know which deficiencies matter most or how ignoring them quietly accelerates damage long before symptoms appear. And understanding that difference may be the single most important shift you make in how you approach diabetes from this point forward. You don't need to change everything overnight to change the direction of your health. What matters is understanding why your body has been struggling and realizing that you still have influence over what happens next. Blood sugar control isn't about perfection. It's about giving your body the tools it's been missing. So insulin can work, inflammation can calm down, and damage can finally slow instead of quietly accelerating. Start small today. That might mean checking your vitamin status, adjusting one habit, or simply paying attention to how your body responds when deficiencies are addressed correctly. These aren't dramatic moves, but they're the kind that compound over time. When the right nutrients are in place, many people begin noticing steadier energy, fewer spikes, clearer thinking, and lab numbers that finally start moving in the right direction, often within weeks, not years. And remember, you're not alone in this. Managing blood sugar can feel isolating and overwhelming, especially when progress feels slow. That's why staying informed matters. New research is constantly changing what we understand about diabetes, insulin resistance, and long-term prevention, and having access to that information can make a real difference in the choices you make. If this video helped you see your health from a new angle, take a moment to save it so you can come back to it later. Subscribe to the channel to receive the latest research-based insights on blood sugar, metabolic health, and long-term prevention explained clearly without hype. And if something here resonated with you, share your thoughts in the comments. Your experience might be exactly what someone else needs to hear. Small informed decisions today can protect your health tomorrow. Stay curious, stay consistent, and keep taking care of yourself.